Hey, what's up everyone? This is Dr. Jen. Welcome back to my channel. And today we're going into fall, so I'm gonna talk to you about something that we all experience, especially with more screen time, and that's dry eyes. If you're dealing a lot with dry eyes, I'm gonna tell you all the little secrets and tips on how to improve it so that overall you're feeling much better, and even signs and symptoms that you may not even know about. One example of this is when your eyes water when it's cold or windy outside. Does that sound like you? If that's you, that's actually a sign of dry eyes. We're gonna break it down into easy steps, including lifestyle routines, over-the-counter treatments, as well as things you can do in office to provide you with longer-term relief. So let's jump right into it. So why don't we just start with dry eye anatomy 101. The reason why you blink is to help spread your tears. Your tears are made up of mostly 3 components, but the most important ones are meibomian gland oil and aqueous tears. They need to mix together, so when you blink, it acts like a windshield wiper to spread the tears. And what happens is, surprisingly, 86% of people deal with a function called meibomian gland disorder. And this is when you don't make enough oil because the oil glands get clogged. Now, there are a variety of other factors, but you can guess what contributes to this. Here are some examples. Screen time. With the pandemic, everyone's working at home more and more, and we're spending so much time on our screens and our phones that it's causing dryness to skyrocket, even in kids. The second thing is contact lens wear. Contact lens wear, especially when you work at screen, is what causes dry eyes as well. Now, there are a variety of other genetic factors and factors including medications that we take. Some examples include rosacea that can cause dry eyes, as well as hormonal changes, age, but also certain medications that we can think of. Antidepressant medications, ADHD medications can cause this as well. And some are surprised, but allergy meds, anything that is a nasal spray or an antihistamine, because it dries out the sinus, it also dries out the eyes. There are certain environmental factors that can also cause it. Changes in the season, when it's colder, when it's wintertime, as well as living in a place that's less humid. An example of that is Arizona. So I'm going to share with you next the tips, and we're gonna break it down with the first one, which is lifestyle factors, what you can do. So for lifestyle factors, here are 3 things you can do. The first step is to get a humidifier at home, especially in the winter months. A humidifier is very important because it helps with moisturizing the air and it helps with our eyes. Now, you can put it next to your desk when you're working, or you can put it next to your bed when you are about to go to sleep. Number 2, take frequent breaks in front of screens. Remember to blink so often. It's one of the things we tend to forget when we look at screens. And generally speaking, our blink rate decreases by at least half of the time when we look at screens. Did you know that? So blinking is quite important. And a quick way to remember is the 20-20 rule. That means every 20 minutes, you take a 20-second break to look at something 20 feet away. And that helps us to remember to blink and relax our eyes. If that's hard for you to remember, because I know I don't remember every 20 minutes, I would just say simply every hour, take about a 5-minute break. Get up, go to the bathroom, get a drink, grab a glass of water, talk to your friends, your coworkers, and then come back and work. And that's easy to remember. There's so many tips though, but I would say the third tip is, let's say you wear contact lenses. I would choose glasses over contacts when you're working on screens. Remember to take them out and choose healthy options, such as daily contact lenses, which have more moisture in them. And the last thing is, I know I said 3, but remember to stay hydrated because that is key to keeping your eyes moist. Okay, moving on to over-the-counter solutions. Now there's so many drops and products all over the eye care section. Sometimes it's so hard to know which one to get. It can be very confusing, especially with the drug recalls and the eye drop recalls. It can be scary to choose the right product. But let me just simplify it down for you. The only things you need are these things. The first thing is, honestly, you just needed an eye drop for lubrication. Now, look for one that comes in a preservative-free vial. And that's especially very important if you wear contact lenses. Why? Because it's preservative-free, it's gonna work with your contact lenses, and it has less preservatives that can continue to irritate the eyes. Avoid lysine. These products have specific ingredients that cause a rebound effect, so your eyes only become more dry and more red as you use them over time. The second tip for over-the-counter usage is to go for a thicker gel or an ointment even if you deal with more dry eyes. So the gel is thicker in viscosity and an ointment is even thicker. Before you go to bed, consider getting sustained nighttime gel ointment, which comes in a tube, and it works kind of like Neosporin. It creates this nice thick lubricant over the surface of your eyes while you're sleeping to create this perfect barrier to protect the eyes and moisturize it. And tip number 3 is to get hypochlorous spray for the eyelids and eyelid wipes. Now the eyelid texture is completely different and the skin there is much thinner. There's different types of buildup on the lid. Think of it like plaque on your teeth. You'll get plaque, and if that turns into cavity, that's not great. So in the eyelid, we develop sometimes bacterial buildup if we don't clean it properly. So if you go to the gym and you work out a lot, there can be bacteria that grows on the surface in the lids, or you rub your eyes a lot. One thing that you definitely want to get over the counter is called the hypochlorous spray. And I have one called iGenix that you can consider. Hypochlorous spray, you can use it when you fly on planes, when you are not getting enough sleep, right on top of your makeup. You just want to spray on top to maintain clean eyelid hygiene. Eyelid wipes are also great. You want to look for ingredients that have tea tree oil in it because that's going to help keep the lids clean and prevent it from developing bacteria growth. Sometimes lifestyle choices and over-the-counter solutions are just not enough. Our eyes are going through a lot more strain and screen time that simply we just need something more. And honestly, you may not want something that you have to do with a 10-step routine every single night. It's just hard to remember, and you may not like putting in eye drops. So now let's move into tips of what can actually work when you go to the doctor's office for prescriptions for eye drop medications and in-office treatments. Because I've tried them all, and I have a lot of treatments that I offer patients, and I'll tell you what really works. Okay, so the first one is drops. Let's talk about what's out there. They're cyclosporin drops. You can think of that as drops that help reduce inflammation in the eye, or drops that help promote aqueous tear production. So some of these include Cequa. Cequa is a great drop, as well as Xiidra and Restasis. Now these drops are typically twice a day. They're spaced 12 hours apart, and you have to use them on time. Now these drops help, especially if you are aqueous deficient, which is a condition that is lack of production of tears because you're not making enough from the lacrimal gland. This is typically more common in someone that has a chronic inflammation, systemic body inflammation, for example, rosacea, if you have thyroid disease, or any other type of autoimmune condition, or someone that's older in age that's not producing as much tears, or Sjogren's syndrome. So there's a way to test for that. Now, drops are great, and it goes to the pharmacy and you're prescribed it by your doctor. So it's important to see your eye doctor to see if you are the right candidate for this. There also is a drop called Mibo. Mibo is a drop that can be used to help mimic your oil film that you produce. We talked about how 86% of dry eye comes from meibomian glands. Mibo is a drop that you can use 3 to 4 times a day in the eye to help reduce the amount of dryness that you deal with. Another drop is called Xdimv. Now this drop is great because it works really well for someone that deals with eyelid inflammation related dryness. Typically this is called blepharitis. Blepharitis is eyelid inflammation and might build up on the lids. This helps to reduce and eradicate that, and it's done so that it is used in conjunction with other treatments. Now moving on to options in the office, and this is partially why I started Line of Sight. I remember a patient who came in during the pandemic, and she went to every single doctor out there for treatment for her severe dry eyes. She was dealing with chronic dry eyes to the point where she could no longer work on screen. She had to switch her job. She had to work part-time, and she ended up scarring on the cornea, and this was actually causing her to have some vision loss. She wasn't able to sleep at night, and when she woke up, she was dealing with so much pain to just open her eyes up in the morning that she basically flew out to see me, and she traveled. When she came in, we went over exactly all the things she's tried and reviewed every single medication drop. She's done punctal plugs, and guess what? Nothing worked for her. And I was thinking, what else could I do for her? And that's when, with Line of Sight, I was thinking about how can we bring in all the regenerative options available for a patient. If they just knew that there were these options available in office to help treat them, wouldn't they want that instead of having to rely on medication after it occurs? I'd hate to put a Band-Aid on a problem afterwards just for it to happen again. And so moving on to these amazing new technologies that help with dry eyes, there are often treatments I do in the office. One of the treatments is called Intense Pulse Light, or IPL therapy. IPL therapy helps with the eyes to help produce tears, and specifically it works to target the meibomian glands as well as eyelid inflammation. IPL is a great treatment for anyone that deals with dry eyes, mild to severe, and it's great for patients who deal with eyelid inflammation. That means chronic red eyes, red itchy lids, blepharitis on the lid, which is buildup on the lid margin, itchy lids. This is such a great treatment, as well as for even styes. Now, IPL is done with pulses of light on top of the skin around the eyelids, and it helps to safely deliver energy pulses. The pulses of light help to stop inflammation, which is the root cause of dry eyes for some people. Now, when it does that, it helps to send enough energy to also melt a little bit of the oil glands to thereby help produce more tears in the eyes. A second treatment that I do often is radiofrequency for dry eyes. This is such an amazing treatment for patients, especially if your eyes water a lot or you're a frequent blinker, or if you have meibomian gland dysfunction or gland loss. This treatment helps. It feels like a hot sun massage on the lid. Your eyes are completely closed, and the amount of energy that's transmitted goes into the subdermal layer of the skin, into the eyelid, where it helps to break down and unclog your oil glands. And it hits the melting point of 43 degrees Celsius, and this temperature is what helps to truly melt it, kind of like an ice cube. Now, when we can slowly release the oil, it gets your glands to return back to its normal function, which is our goal. And now these treatments help to target the root cause. And with this ability to do so, we're able to give you this longer-term solution for your problems. Third option to consider is amniotic membrane. We can actually use stem cell treatments on the eye, and this can help with dry eyes. Did you know that? Now, stem cells come from, if you can guess it, pregnant women when they give birth, the amniotic membrane. Now, the fetus sits in this membrane, and it has amazing potent nutrients that help to heal surfaces, has anti-inflammatory properties, and it has the ability to regenerate surfaces. Now we have the ability to use it on the eyes in the form of a contact lens ring. And we use either Prokera or CAN 360 contact lens. When it's used on the eye, it helps to heal corneal nerve endings. This is great for someone that deals with dryness post-LASIK surgery, or those who get cataract surgery, or if you had an ulcer on the eye or an infection, it helps to heal those surfaces as well. And if you just deal with very symptomatic dry eyes that's causing issues on the surface, as well as corneal erosions, corneal abrasions, reoccurrent issues like that, this is a great treatment for you to help regenerate the surface. Well, I hope the tips were really helpful for you, and that you hopefully learned a little bit more about dry eyes today. Trust me, this is so common. I deal with it every day, even right now as I'm making this video. So I just want to make sure that your eyes are healthy and that it's preventative for you, because our goal is to make sure that your eyes in the long run stay continuously moist so that you can work on screens, so you can live the lifestyle that you want, wear your contact lenses, wear makeup, and go to the gym. Now, it's why we focus on all this regenerative treatment and the preventative care. And it starts with you watching videos like this now. If you're interested in more videos like this, you can click on the other links that I have so that you can see more videos on dry eyes. And here's something I want you to do. In the comments, write all the symptoms of your eyes that you might have that you think are dry related. And I'm going to answer you and let you know if those are symptoms of dry eyes or not. And also any questions that you have. Don't forget to hit the subscribe button so that I can make more videos. I'm just starting to get back on YouTube, but you guys will help motivate me by hitting the subscribe button. Thank you.